My name is Dr. Jamie Hardy, and I am one of the care coordinators in the Office of Student Care Coordination. The Student Care Network is a holistic network of well-being and health resources available to Vanderbilt students, including undergraduate, graduate, and professional students. There are 4 primary offices that comprise the Student Care Network, including the Office of Student Care Coordination, the Center for Student Wellbeing, the University Counseling Center, and the Student Health Center. We understand that well-being is not only physical and emotional health, but also includes culture and identity, academic, financial, and social well-being. In addition to these 4 primary offices, the Student Care Network includes multiple layers of support, ranging from the Project Safe Center, all of our identity centers like the Black Cultural Center or the Office of LGBTQI Life, academic support through your school, and off-campus providers in the community. An important component of the Student Care Network is our satellite services program. Satellite services are a way for students to access support in spaces and places where they feel most comfortable. Many Student Care Network offices partner together to promote health and well-being opportunities in various locations across campus. You can find the calendar for satellite services on the Student Care Network website. It's important for students to take an active role in their well-being and advocate for their own care. Students can also access self-directed resources to support overall well-being. For example, all students have access to WellTrack, a wellness app where students can track their mood, journal, follow modules to manage stress, anxiety, and depression, and even share information with their counselor at the University Counseling Center to enhance individual therapy. Students can learn more about WellTrack and other self-directed resources on the Student Care Network website. We encourage students to visit www.vanderbilt.edu/Student Care Network to learn more about the resources Vanderbilt has to offer and to feel comfortable knowing where to go when a need arises. We recognize that things are changing quickly during the COVID-19 pandemic, and the Student Care Network offices are working hard to find innovative ways to serve students in a remote environment. You can find all of our updated services on the Student Care Network website under Updated Services. We also encourage students to follow the Student Care Network and all of the offices we'll talk about today on Instagram. Because we have so many wellness resources available at Vanderbilt, the Office of Student Care Coordination is the central and first point of contact for students to identify needs and determine the most appropriate resources in the Vanderbilt Student Care Network and in the Nashville community. Our team of care coordinators support undergraduate, graduate, and professional students in successfully navigating life events related to academic stress or medical, mental health, or other personal concerns that may interfere with a student's ability to achieve their academic and personal goals. The Office of Student Care Coordination also supports students returning from medical leaves of absence. When you meet with a care coordinator, we work collaboratively with you to develop a plan for success, facilitate connections to appropriate on and off-campus resources, and provide continuity of care and accountability through supportive follow-up meetings. Once you are connected, this support is available to you throughout your time at Vanderbilt, and you can always reach out to your care coordinator if other needs arise. Many students face challenges during their educational experience, and each situation is unique. Our goal is for students to have the right support in the right place at the right time. Though staff typically have a background in mental health services, it is important to understand that work with a student care coordinator is not counseling or therapy. In order to connect with the Office of Student Care Coordination, students should visit www.vanderbilt.edu/care coordination to complete an initial assessment and schedule an appointment. Students may also call 615-343-WELL, 615-343-9355.
Hi, I'm Dr. Sierra Scott, licensed psychologist at the Vanderbilt University Counseling Center, also known as the UCC. The UCC is the primary on-campus mental health service for students and an integral component of Vanderbilt's Student Care Network. The UCC strives to facilitate the emotional well-being and academic success of Vanderbilt students by providing short-term mental health services that are flexibly optimized to a student's needs and goals in a safe, inclusive, and affirming space. We offer a variety of services, including group therapy, individual therapy, daytime and after-hours crisis care, and a variety of outreach initiatives to support our undergraduate, graduate, and professional students. In order to ensure Vanderbilt students have convenient access to our counselors, we also offer a regular drop-in consultation service. In addition to therapy and drop-in services, the UCC has a team of psychiatrists and psychiatric nurse practitioners who oversee medication prescription and management for a variety of mental health conditions. Our staff is a dedicated team of professionals with varied ethnicities, gender identities, sexual orientations, theoretical approaches, and clinical expertise, in addition to other multicultural intersecting identities, which allows us to effectively serve Vanderbilt's diverse student population and ensure that students are resilient, well, and successful. All the staff at the UCC participate in trainings each year to ensure that we are providing innovative clinical services, and because we know the pathways to mental health and wellness vary widely, the UCC offers a range of clinical interventions to meet each student's needs in the most effective way possible. The UCC's full scope of clinical care is available on our website at www.vanderbilt.edu/UCC. The UCC is working hard to support students in a virtual environment, and updated information about delivery of our services can be found on our website. We are physically located at 2015 Terrace Place, right across from the Baker Building, and we are open Monday through Friday from 8 a.m. to 5 p.m. We will be offering some extended hours during the academic year, and this information can also be found on our website. For new students wanting to connect with the UCC, please first complete an intake assessment with the Office of Student Care Coordination. Students can also drop in to crisis care counseling Monday through Friday from 10 a.m. to 4 p.m. or connect with crisis support by calling the UCC at 615-322-2571 to speak with an on-call clinician 24 hours a day. Again, please visit the UCC website for updated information regarding the status and breadth of in-person and virtual mental health services offered by the UCC.
I'm Samantha York, and I'm an academic skills coach in the Center for Student Wellbeing, or CSW. We are part of the continuum of care within the Student Care Network, and we are committed to helping students thrive within the Vanderbilt community and maintain lifelong well-being practices. Our primary activity in the CSW is one-on-one coaching to help undergraduate, graduate, and professional students set goals around healthy behaviors, offer strategies for achieving those goals, and maintain accountability on the way to meeting those goals. Coaching goals may include stress management, time management, academic skills, relationship building, or behaviors related to the use of alcohol and other drugs. Undergraduate students may also meet with our peer guides, well-trained upper division undergraduate students who offer well-being coaching only. In addition to one-on-one coaching, we offer many workshops, including academic skills, surviving and thriving with ADHD and other executive function issues, and alcohol and other drug education. We also offer ongoing well-being practices, including meditation, which we're currently offering via Zoom. The CSW is the home for Vanderbilt Recovery Support, or VRS. VRS provides support and accountability for those concerned about alcohol or other drug misuse, as well as those who are actively in recovery from addiction. VRS offers regular meetings and supportive programming, including one-on-one coaching and monthly seminars. The CSW also offers substance use screenings for students to gain more information about the impact of their substance use. The CSW works with student groups dedicated to promoting well-being on campus, including the Imperfection Project, which provides students the opportunity to share their stories of successes and failures in order to bring awareness to setbacks as a healthy part of every student's college experience. And LEAPS, a peer educator group that works to promote positive mental health and well-being on campus. For more information on any of our center's offerings, please visit our website and find us on social media. To schedule a phone or Zoom meeting with one of our coaches, please call the center at 615-322-0480 or email healthydoors@vanderbilt.edu. Coaching services can also be scheduled through the Office of Student Care Coordination.
My name is Jonna Whitman. I'm one of the physicians at the Vanderbilt Student Health Center, and I also serve as the Chief of Clinical Services. The fundamental mission of the Student Health Center is to care for the Vanderbilt student body, providing both preventative care and acute care. We are equipped to serve as your primary care provider while you are a student at Vanderbilt. Many students are on the student insurance plan, but we see all students regardless of insurance coverage. We can care for complex patients needing regular, ongoing primary care, but we can also see those with minor illnesses. There is no fee for office visits, as your general students' fees cover this. When you are seen in the office, there may be a slight charge for medications, supplies, labs, or in-office tests, such as strep or mono tests. In general, we try to keep out-of-pocket expenses to a minimum. If you have chronic medical issues that require regular use of medications or frequent doctor visits, we encourage you to schedule a visit with one of our providers to establish care. For acute medical needs, such as a sprained ankle, the flu, or gastroenteritis, we still encourage you to schedule an appointment, as we reserve many slots each day for last-minute appointments. If you walk in without an appointment, you will still be seen, but the wait might be longer for you than for those with scheduled appointments. In the current era of COVID-19, we can assess and test students with symptoms suggestive of COVID-19. Our office is arranged to keep those with COVID symptoms in a different area from those who do not. To schedule an appointment at the Student Health Center, you can always call. Perhaps an easier way, however, is to register for My Health at Vanderbilt, an online portal through which you can schedule appointments, see your lab results, view your immunization records, and message your provider directly with any questions or concerns. We have an insurance specialist on site at our clinic that can help with any insurance questions that arise, whether you are covered by the Vanderbilt student plan or another plan. In general, we would like you to consider all of us at the Student Health Center your advocates, here to meet your medical needs, answer questions, help solve problems, and direct you to other resources available on campus. If you have a medical issue or concern, don't suffer in silence. Rather, reach out to us and we'll help navigate the landscape, whether it involve a health problem or symptom, a billing concern, or an insurance question. On behalf of the entire Student Care Network, I wish you a healthy and safe Vanderbilt experience.
Vanderbilt is committed to promoting good health and ensuring students' medical needs are supported. That's why all students registered in degree programs of 4 or more credit hours, or who have actively enrolled in research courses, are required to have high-quality health insurance. These students are automatically enrolled in Vanderbilt's Student Health Insurance Plan, which is administered by Gallagher Student Health and Special Risk. You may wonder if Vanderbilt students can elect to waive the Student Health Insurance Plan. Domestic students who have existing insurance coverage that exceeds or equals the Student Health Insurance Plan may request to waive the insurance no later than August 1st. International students are unable to waive the Student Injury and Sickness Insurance Plan. We encourage you to keep a copy of your health insurance card with you at all times. You may download a copy of your Student Health Insurance Plan ID card by creating an account at www.uchcsr.com/myaccount. It's important to know what medical services are covered under your health insurance. You may review the benefits under the Student Health Insurance Plan by visiting the Student Care Network website and clicking on the Student Health Insurance tab, or by logging in to your Gallagher student account at www.gallagherstudent.com/Vanderbilt. Health insurance terminology can be confusing. That's why we have a glossary of common health insurance terms, such as deductible and copay, on the Student Care Network website under the Student Health Insurance tab. Students with the Student Health Insurance Plan can also contact our on-campus Student Health Insurance Liaison, Christina Miller, with questions about their coverage. She may be reached at christina.miller@vumc.org or 615-343-4688. The Student Care Network is here to support you throughout your time at Vanderbilt and wishes you a successful academic year.